Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We're a health system with 3 academic medical centers, and our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. I'm your host, Kristen Gradney, Chief Wellness Officer. Today, we're joined by Dr. Ben Springgate and Dr. Seth Vignes. Thank you guys for joining us today.
Thanks for having us. We're really excited to be here.
Thank you.
First, before we get started, I'd love to hear just who you are, how you got started in this work. Why does it mean so much to you?
I'm Seth Vignes. I'm a LSU hospitalist and addiction medicine researcher. I started in this space about 4 or 5 years ago, kind of out of residency, realizing that I was struggling to take care of this population. I wasn't doing the best job. And so I just sought to kind of educate myself about it. And one opportunity led to another. And that's how I got involved in the research at LCMC.
Here you are. And Dr. Springgate.
Similar to Seth, I'm an internist by background. I trained in internal medicine and pediatrics. And about 8 or 9 years ago, working with another one of our colleagues, Dr. Marcus Bachhuber, we came to recognize that there were really very few places for our patients with substance use disorders to receive care. And so while we're trying to provide the best possible care, as many as 20% or more of our patients have substance use disorders, and they didn't have anywhere to go. So we decided we were going to open up a clinic focused on those patients, and I learned more and sought to educate myself, and here we are years later and making strides.
Wow, so 20%. That's a huge number. So that tells us there's a huge need in the community. It sounds like both of you developed this work and this passion out of need. You see a community in need and figure out how do we address it, because that's a pretty large number. So and here we have at LCMC Health, we have a new initiative, right, to address it. And you guys are leading that work. So tell us, what exactly does that mean for this community?
I think it's huge. I think it's, previously to these initiatives, it's been a lot of provider-specific outreach or initiatives, and having the system lead a top-down initiative is massive. As Dr. Springgate mentioned, the need is large. We're seeing rates of medications for opioid use disorder much less than we would expect nationally in our community, and the prevalence here for opioid use disorder is very high nationally. And so I think having a system-led initiative is really the way to go about it, and we're just really happy to partner with LCMC on it.
What do you attribute that gap to? So you said really high opioid utilization, really low utilization or dispense of the meds that could help in this case. What's it?
I think primarily it's a lack of education. It's a new playing field. These are old medications, but their use in from an internist perspective is relatively new. We used to have what was called an X waiver for using one of the medications, Suboxone, that has been dropped over the last 3 to 4 years. And so people are ramping up with their familiarity, and having LCMC kind of backstop that and provide education, provide resources, provide order sets, provide integration with outpatient resources is really helpful for the providers.
So it sounds like this initiative is more than just like a freestanding come and get help. It's more of an approach, a system-wide initiative to embed this work everywhere that we can. Is that
I think that's fair to say. And I think, part of what you're hearing as well, and part of the opportunity is in Orleans Parish in the last several years, overdose deaths have been the 3rd leading cause of death. It's also extremely high in Jefferson Parish and the other communities that we serve through LCMC Health and through LSU School of Medicine. So we recognize that if we want to make an impact there, we have to try to maximize the likelihood that anytime someone comes in with a substance use disorder into the emergency department, into a hospital, into one of our clinics, the nurses, the doctors, the staff there feel ready, educated, prepared to get people into care, to provide them with the best treatment possible, to provide referrals if necessary. And so that's really part of what this initiative is about. And by, spreading resources across emergency departments, across all of our 8 hospitals, we're really maximizing the likelihood that people will get the best care.
And you mentioned emergency departments. So part of this initiative is having Narcan available in emergency departments and distributing rescue kits. Help us understand what exactly that means for the community.
Well, Narcan is an overdose reversal medication. It can be administered by anyone, a bystander, a family member, a friend, a coworker. So if someone overdoses on an opioid from fentanyl or from pain pills or something like that, and they are unconscious or potentially at risk of dying from an overdose, the bystander can provide that nasal spray for that patient who's down on the ground, for their friend, their neighbor, their coworker, and revive them as they're waiting for 911 and for the emergency services to come. And that can save a life. And so we really want to see as many of these Narcan kits distributed to people who are coming through our facilities and maximize the likelihood that the next time someone is at risk of overdose, there's someone nearby who has Narcan on hand.
And so the kits are for someone who is being treated in the ED, or can someone just come and get a kit from the ED?
I think it's wonderful what LCMC is doing. They're doing it in kind of what we call a community distribution model, which is a patient can get it who's in the ER, their family member can get it, their caregiver can get it. They're also looking at ways to just have people who want to receive Narcan just come in and get it themselves. And so it's really a low barrier model that I think is unique.
Yeah, that's important to be able to share and highlight, because it does save lives, right? That would contribute. And with 20%, I keep going back to that 20%. That's such a huge number. And another part of this is having navigators, so specifically substance abuse navigators in our system. Who are those navigators, and what exactly do they do?
Substance use navigators are a really unique profession, I think, and I think it's going to be really crucial for us. Essentially, a substance use navigator is someone with usually lived experience, who's a professional, who's basically going to stick with the patient throughout their ED stay, their inpatient stay, and afterwards, and really be a resource to that patient in connecting them with ongoing substance use care. And so that can look like them starting on medications for opioid use disorder like methadone or buprenorphine. It can also mean just linking them to community resources to continue that care. We do an okay job of doing inpatient hospital care for substance use, but once we discharge that patient, we somewhat lose access to them. And so the substance use navigator allows us to stick with the patient the whole way, and also gives the patient a resource to reach out to if they have questions about care.
Yeah, true care beyond the four walls. I mean, that's what we say, creating a cultural wellness, which is often done in the community where people actually live and thrive, not just in our four walls. So it sounds like this is to make sure that once people walk out of our doors, they continue to have support. And
definitely. And it's important to recognize that part of the value of that is, as much as we can highlight and recognize the high number of 20% of our population has a substance use disorder, only a small fraction of those people are actually receiving care for their substance use disorder. So probably about 1 in 8 people with a substance use disorder is actually getting any treatment at all in the last 12 months. So that's a tremendous opportunity if we want to help folks overcome their substance use disorder, improve their associated physical health or mental health challenges that can come along with a substance use disorder. If we can get to that other 7 out of 8 people, then that creates a tremendous opportunity to make a difference in our community.
And thinking about, the third cause of death, that this is pretty high up there. So if we can impact people and get them support and help, then maybe that cause of death would go down and we wouldn't see so much.
Yeah, we really think about the ED stay and the hospitalization as almost a sentinel event where we have an opportunity to do good for our patients. But so many times we lose access after discharge. And I think the substance use navigator really is a great linkage to connect care that may have started in the hospital to outpatient or in the community.
This is amazing work that is obviously life-saving. It's work that, we will see fruit of for many years probably, but you can see the impact of it, in short order as well. And it sounds like you guys have been recognized for some of this work. The American Hospital Association and Health Research and Educational Trust saw that you guys were doing some great work, and now you're part of a collaborative. Tell us more about that.
The Learning Collaborative with the American Hospital Association allowed us to connect with other systems around the country who are tackling this in their communities, systems in California, systems in Washington State and Oregon, systems in Kansas and on the East Coast. We're all sharing best practices. We're trying to help one another learn and implement new initiatives to really expand access to high quality care. And that raises the profile of this in our local community. It raises the profile of this among our hospitals and academic partners, our peers who are doctors and nurses at these institutions that we're working with. And that really, creates momentum. And that momentum is going to allow us to do more for our patients.
Yeah. That's great that this work is happening here, but really learning and sharing across the country, which always, rising tides lift all boats. So hopefully we're doing that here. And the LSU Health Integrated Health Clinic at University Medical Center, UMC, brings together primary care and addiction medicine all in one place, under one roof. Why is co-locating those two services so important for long-term recovery?
One of the things that we recognize is that if there's a person who has substance use disorder, that they frequently feel shame, or they feel stigma, or they feel bias when they try to engage in healthcare services. But by offering these types of specialty services in a regular primary care clinic, along with all of our other primary care patients and primary care clinicians, they don't have to feel that shame. They can feel like, hey, I'm just going to the doctor and I'm welcomed here just like anyone else. And that helps, and that overcoming that shame and that stigma really increases the likelihood that they engage in care in the first place, as well as that they'll continue to participate in follow-up care and stay in sustained recovery over time.
Yeah. Thank you for thinking about that aspect, right? Like a lot of times we say, oh, we just need a clinic, we need care, but not thinking about the impact that it has on someone to set foot into a clinic that may have a stigma around it. Or, somebody sees me walking into this clinic, everybody now knows I have an addiction issue, right? So that is so important. And, what I'm hearing is a recurring theme in this effort is really fostering a culture of care and treating substance use disorder as a true medical condition, not, something that someone has chosen for themselves. So how are you actively working to address implicit bias amongst healthcare providers and others, not just in this way of having this co-located space, which is amazing, but what other areas are you addressing this in?
Yeah, I think this is a really important component of what LCMC is trying to accomplish in these initiatives. And I think a lot of it stems from partnership and education. And 4 years ago, I was very unfamiliar with this space and I had to self-educate. And now having the ability to kind of teach others what I've learned and be a resource is really important. I think there's a sense of frustration a lot of times for healthcare professionals because the outcomes are so poor and we feel, sometimes unsupported or we don't know what's the right thing to do. And so I think the first step is just educating, providing evidence-based guidelines, order sets, things that lower the barrier for their provider to feel like they're giving good care. And that'll somewhat mitigate some of that frustration and burnout that you can experience taking care of this really, really tough to treat population.
Sounds like you guys, again, are thinking of every aspect of how to make sure that you're caring for not only the patients who are experiencing this challenge, but the providers. Because I would imagine that as a physician, it's very challenging when you have someone come in and don't feel like you have resources. So creating all of this infrastructure helps the community, but also helps physicians and practitioners do their job a little bit better too, which is important. And this is a lot of work, right? That you guys are leading the charge on and really important work that impacts so many. So we always ask, how do you care for your well-being? How do you support your own well-being as you're doing this work that cares for so many others?
Yeah, I think work-life balance is really important for me. I think spending time with my family grounds me, centers me. I like to garden. I like to fish. Those are some of my hobbies.
What's in your garden right now?
I'm growing a lot of food. Like eggplant, okra, they're doing great. My tomatoes are not doing great. They're gone. But it keeps me grounded.
The heat is hard to compete with right now. And what about you, Dr. Springgate?
Likewise, time with my family is particularly important. And we spend a lot of time on the soccer field. Personally, I like to play soccer, get exercise. So that helps me as well. And, it's also really great knowing that when you do come to work, there's a great team. We're lucky to work with people like Amy Prime in population health at LCMC. We work with other physicians, nurses, leaders across the spectrum, and it's great to know that there's a supportive environment.
So soccer, the World Cup was earlier this summer. Who are you rooting for?
There were so many great teams. I was not disappointed that Spain won, but I think it would have been really fun to see France or England win.
Awesome. Well, I hope that you had some time to enjoy that as well. And, thank you both again for caring for the community in this way that's so impactful, not just years from now, but really today, you're saving lives. So again, thank you for being here with us today. And thank you for joining us and listening. Join us as we go beyond extraordinary on the second Tuesday of every month.